So, hi, I'm Jim O'Connell. I am a founding physician and the president of the Boston Healthcare for the Homeless program. And I'm reflecting now on our 40 years, which blows my mind, to be very frank with you, that I've gotten that old and that I've been in the same job for all this time. But mostly what I feel after 40 years is just an immense sense of gratitude. Gratitude to not only the people we've been serving all this time, but to the people I get to work with, to our partners at the state, the city, the shelters, the hospitals. It's been really quite remarkable. And if nothing else, I've learned in these 40 years that we at Boston Healthcare for the Homeless program are only as good as the partnerships we have and the supporters who allow us to do what we do. So just reflecting, I took this on I was kind of conscripted to do this job, and I decided I'd do it for 1 year under some duress, but I thought it was my year to give back. But that 1 year gave me enough time to realize how complicated the care of homeless people can become. We were struggling that first year with an outbreak of tuberculosis. It was multi-drug resistant, and the AIDS epidemic had just come into the homeless community and was devastating the folks there. And we had no treatment. Everybody was dying. So I can remember being just overwhelmed by being a few blocks from the hospital, but awash in these deadly epidemics. But it laid the groundwork for us to realize that we really had a role, that trying to take care of people and do it in a way that we could help the people that were doing housing, help the people that were in the hospitals, to care for people, use specialty clinics, and most of all, to be sure we could reach out to wherever homeless people were, to reach out and take care of them. So I think the best part of this job has been the mission we've had, which is to go to wherever people are, to take care of them. Because as you would know, trying to survive in the shelters and on the streets is an immediate problem. You don't have time to go to an appointment next week at 2 in the afternoon. So we had to fill in those blanks, overcome the obstacles that people without homes have to getting good health care. And I can remember initially, early on, it felt like we were doing a lot of episodic and urgent and emergent care in the shelters and on the streets. But as our clinics got more and more sophisticated and we were able to be there consistently, we started to realize it was a lot about managing chronic diseases, working together with how to integrate the behavioral health with the medical care to make sure we could provide dental care, so that you could begin to provide really an array of services that can be part of the mainstream of what I would consider one of the best healthcare systems in the world here in Boston. So that has been our mission. And in many ways, if you look around, you will see that we've done that in extraordinary ways. And I look around now and realize this is all being done by people way younger than I am. But I kind of take some satisfaction knowing that because of all of you who have been our supporters and these remarkable young clinicians, nurses, doctors, nurse practitioners, social workers, we've been able to sort of blanket the city and really provide integrated health care for homeless people. I look around the country, and we've been blessed to be in Massachusetts, so that our support from the governor, from Medicaid, through all the years, our support from the city of Boston, from all of the mayors, from the Boston Public Health Commission, and then particularly our ability to we're in 30 or 40 different shelters and soup kitchens, and the fact that they welcome us in as visitors to be able to do the healthcare is a remarkable story in itself. I would argue the only city in the country that has a real integrated healthcare system for people living in shelters and on the streets. It's a single system, blessed by all of our mainstream health systems. So this has been a great job. And I would urge you to look into some of the things we do. When I think of our HIV care now, when back in the beginning everybody was dying, now we have 90% of our folks who have HIV with viral suppression because of a very aggressive outreach team. Hepatitis C is essentially being eradicated in our program. We provide great diabetes care. Cancer tends to be one of our leading causes of death, but we've learned how to do not only early intervention and chemotherapy and radiation, but also to provide end-of-life care for people who really have nothing. So all of these things I would urge you to think about as kind of the challenges that have come before us and which we've been able to respond to with a lot of creativity and a lot of help from everybody there. So I go back to what I think of. I can't believe it's 40 years. It blows my mind. But I am incredibly grateful for the people that have continued to do this work and are bringing it to bigger and better and more effective ways to care for this really disenfranchised population. Finally, I'd simply add that I remember for the first 25 years I did this job, almost no one was able to get into housing. You had to get sober and be on your medication. It was really hard to get in. And then we now have these, since the early 2000s, these very creative low threshold housing programs. So like a miracle, many of our folks are now getting into housing, and we're learning to work with our housing partners. Remarkable places like Pine Street and Home Start, and St. Francis House, who are really providing in Hearth, providing really creative housing for people, and we can then be the partner to do the healthcare once people get into housing. And as we've learned, many of our folks, once they get into housing, it's miraculous, but they still struggle with different things, their chronic diseases and their mental health issues. And we can be helpful in that setting to provide that support. And lastly, I would say what has been fundamental to all of us, I'm saving this for last because I feel it so strongly, is we were put together by a coalition of stakeholders that worked with Mayor Flynn back in 1984 and 85, who demanded that they be cared for. These are homeless people and homeless advocates who insisted that the care they wanted needed to be continuous. It needed to be not a continuing changing cast of characters, but people who would choose their careers in caring for them. And so we were charged with providing continuity of care from shelter and street to hospital. They told us we had to set up a respite program. And they also insisted that they be part of the design, implementation, and the governance of our program. So for all these years, at least since we became incorporated in ways, we have had homeless people, a consumer advisory board made up of homeless people that we serve. And from that group, there are several people who serve on our board of directors. So we've always had the privilege of being hired and fired by the people we serve. And I think being in a program which is really directed by the people we're serving is one of the real fundamental accomplishments of the Boston Healthcare for the Homeless program. We're all in this together, those we serve and those who are serving. And that, I think, has brought all of us a sense of joy and a sense of accomplishment.